We're all born with a unique mix of common traits. Your eyes, for example, are likely to be brown or blue, though they could be a more rare color like green or gray. Most of us don't have any overwhelmingly unique individual traits. It's the combination that makes us unique. Then there are those born with very unique traits and genetic abnormalities, be those for good or ill. I'm Mike with List 25, and here are 25 odd things very few kids are born with. "25. Being two people at once." No, really. I'm not talking about conjoined twins. I'm talking about human chimeras. In the woman, a fetus can absorb the cells of a miscarried twin. The result is that the surviving twin has some of the genes of the ghost twin, which leads to some organs having a different DNA than others. One case like this is Karen Keegan, whose ovaries carry different genes. Technically, she's not the mother of her children. Her unborn twin sister is. 24. Webbed fingers or toes. Webbed fingers/toes are technically called syndactyly. All of our hands start off in the womb as general paddle shapes, but around the 6th week of pregnancy, we start to form individual fingers. When that process doesn't complete correctly, you end up with webbed digits. It's not known why this happens, and it only happens in around 1 out of 2,000-ish babies. It's usually fixed with a simple surgery, though in very rare cases there are bones fused together as well, and correction may be more complicated. 23. Treeman illness. Epidermodysplasia verruciformis, also known as the Treeman illness, makes people really open to HPV and causes malignant skin tumors. Tumors usually start around age 20, and like most skin cancer, they start in places normally exposed. Though symptoms take 2 decades to show up, this is a hereditary disease presented at birth. Multiple uncontrolled HPV infections lead to the scaly malformations that give this disease its nickname. 22. Mermaid Syndrome. Melia is a disorder in which the legs of a baby fuse together in the womb while it's growing, and the result is what's commonly known as Mermaid Syndrome. Though this is usually fatal due to complications with kidneys and other internal organs, Milagros Cerón from Peru, born in 2004, actually had her legs separated and is now able to walk. 21. Vestigial gills. Vestigial gills, or gills left over from when we needed them, sometimes show up in humans. They aren't functional in any way. They're kind of anticlimactic, just showing up as small holes above the ear, until you learn what they are. Then it's just weird and cool. Millions of years after our ancestors left the water, random pieces of DNA are still around to put holes for gills we no longer need or have. 20. Epidermolysis bullosa. This is a rare disorder of extremely fragile and sensitive skin. In fact, children with this disease are often called butterfly children because their skin is as fragile as a butterfly's wing. Even touching them can make their skin blister, bruise, or even tear. This disease is always painful, but it's also possibly fatal, largely due to secondary complications, before the age of 30. Imagine being a child who couldn't be held or physically comforted without immense pain. 19. Derma Pigmentosum. Also called vampire syndrome, this genetic disorder affects your DNA's ability to repair itself, specifically to repair damage done by UV light, such as, sunlight. In extreme cases of this disorder, people can't go out into the sun. At all. 18. Trimethylaminuria. Trimethylaminuria is a genetic disorder that literally makes people smell bad, like rotting fish and eggs bad. It's also known as fish odor syndrome, and it's a metabolic disorder. Basically, people who have this lack a specific enzyme that lets the body convert trimethylamine, which smells bad, from foods into trimethylamine oxide. So the person's body just builds up the trimethylamine and it's released in that person's sweat, urine, and breath. 17. Prosopis. Prosopis is when someone is literally born with two faces. Yep, two. These babies often have other serious issues, such as missing all or parts of their brain, heart defects, or other neural tube disorders. Babies born with prosopis are often stillborn. Luckily, it's so rare that less than 50 cases have been recorded in the last 150 years. 16. Ectopia cordis. Ectopia cordis is the technical term for being born with your heart either partially or totally outside of your body. Babies born with this generally are stillborn or die shortly after birth. However, some successful surgeries have been done. 15. Harlequin ichthyosis. Harlequin babies suffer from a very rare genetic disorder. Do not Google this. It's very sad and upsetting. Babies born with this condition have thick skin covering their bodies, usually in large diamond-shaped plates, hence the name. The plates are separated by deep cracks. This limits the body's movement, including the ability to breathe, and affects the shape of the eyelids, nose, mouth, and ears. People born with Harlequin ichthyosis usually die as infants due to infections, dehydration, and inability to regulate body temperature. But with modern medical advances, some can live to adolescence. 14. Lamellar ichthyosis. This is a condition in which skin cells do not separate and shed as they should, which results in the person with the disease being covered in dark brown scales. Eyelids and lips are also often turned outwards, and people with this condition often have trouble staying hydrated. It occurs in about 1 out of every 600,000 births. 13. Congenital ania. Congenital ania is the technical term for being born without a nose. No, really, no nose. No outside nose, no nasal cavities, no olfactory senses whatsoever. It's so rare, there are only 30 cases recorded in history. 12. Wiedemann syndrome. Proteus, or Wiedemann syndrome, causes an overgrowth of bone, skin, and other tissues in proportion to the rest of the body. It's not apparent at birth, symptoms only showing up between 6 and 18 months of age. This is the condition that Joseph Merrick, also known as the Elephant Man, had. 11. Polymelia. Polymelia is a defect where a baby is born with more limbs than expected, usually a total of 5 or more. 10. Conjoined twins. These unique kind of twins happen when an embryo only partially separates to form two people, instead of fully separating and creating identical twins. Conjoined twins grow together in the womb and are born connected, either at the upper chest, usually sharing a heart, from the chest to the pelvis, sharing gastrointestinal organs, or at the skull, less than 2% of conjoined twins. They can sometimes be separated, but not always, and mortality risks depend very much on the individual twins. There are fewer than 1,000 reported per year. 9. Ambrose Syndrome. This is a condition where hair grows long all over the body, with the exception of the palms of the hands, soles of the feet, and mucous membranes. Remember that old circus poster for Wolf Girl? That was Ambrose Syndrome. There isn't a treatment or cure. Ambrose Syndrome does not affect the lifespan of those who have it. 8. Tails. Vestigial is the term used for organs that we no longer need due to evolution, such as the appendix. Seriously, they're just there to possibly give you a medical emergency at some point in life. Some babies are born with a vestigial tail. Yep, a tail. We all start out with one when we're just tiny embryos, but usually it disappears as the spinal column develops. Tails usually have no bones and are removed shortly after birth. There have been less than 50 recorded cases in the last 100 years. 7. Cyclopia. Cyclopia is exactly what it sounds like. Babies that are born with one eye in the middle of their forehead, like a cyclops from legend. This can affect humans and animals, and is most common in kittens. Most babies born with this disorder die within moments after birth. 6. Hermaphroditism. Hermaphroditism is when a person is born with both male and female reproductive organs. Typically, if this is diagnosed at birth, the reproductive organs of one sex are removed and the genitalia altered to match, though sometimes the surgery may be delayed until puberty or adulthood to stave off gender identity disorder later in life. This happens in about 1 in 2,000 births. 5. Polydactylism. Extra fingers and toes, called polydactylism, can happen to humans and animals. Ever seen a cat with thumbs? Same thing. Often, these are small, boneless extra fingers or toes that can be surgically removed shortly after birth. Sometimes, though, the extra finger or toe will have bone and will need to be completely amputated and have tendons, etc. moved around. This doesn't happen until a child is at least 1. 4. Progeria. This birth defect causes children to age rapidly. Not grow, but age. Which means you have a 3-year-old that looks like someone in their 60s or 70s. It's rare, with only about 1,000 cases happening per year. Children with progeria often die around 14 years old, usually from heart disease. There's also late-onset progeria, known as Werner's syndrome, that starts in the late teens and has a life expectancy into the 40s or 50s. 3. Cleft lip, cleft palate. Cleft lip and cleft palate are birth defects that happen when this part of a baby's face doesn't form correctly in their mother's womb, very early in pregnancy. There isn't enough tissue in the roof of the mouth, the palate, or nose, and the upper lip doesn't close and form together correctly. Thankfully, this is correctable with surgery, allowing children born with this to lead normal lives, like sucking on a bottle, for instance. It happens in about 1 in 700 children, and is more likely to happen to boys than girls. Charities like Operation Smile send doctors and surgical teams to third world countries to repair cleft palates in babies and children that otherwise would not have access to such medical care. 2. Albinism. Albinism is a condition where someone is born with little or no pigment, melanin, in their skin, hair, and eyes. There are different forms, varying from only affecting the eyes to affecting the eyes, skin, and hair. Albinism can affect any race, and animals and plants. 1. Heterochromia Iridium. This is what happens when someone's born with 2 different colored eyes. Think David Bowie. Scientists know what gene accounts for brown-blue eye color and what gene accounts for green-blue eye color, but how those mix to get hazel eyes, different colored eyes, or heterochromia iridis, different colors in the same eye, isn't quite so clear. Yet. Enjoying our lists? Be sure to click that subscribe button in the top right corner so you don't miss out on new ones every Monday through Friday. Share them with your friends and help us consistently conciliate curiosity. And if you want even more lists, check out these 2 videos here, or just head to our website at list25.com.